for a lot of these patients, starting a ketogenic diet can be super challenging. So we thought a supplement could actually be a way to achieve ketosis that is more achievable for more patients.
We've heard a lot about the benefits of ketogenic therapy based on a ketogenic diet and the impact it can have on symptoms of mental disorders. But what about drinking ketones, exogenous ketones? Well, Dr. Huizer from the Netherlands is starting to study this, and it's early with pilot studies, but so fascinating to consider. Will drinking ketones have similar effects to eating ketogenic diets and metabolic therapies? So let's hear from this interview from Dr. Huizer, not just the experience she's doing, but also her personal experience and this community of metabolic psychiatry in the Netherlands. All right. Well, Dr. Karin Huizer, thank you so much for joining me at Metabolic Mind.
Thank you for having me, Brett. It's a pleasure to be here.
Yeah, and I'm so excited to talk to you. And hopefully I got your name pretty close. We talked about the Dutch pronunciation, which I'm not so good at, but that's part of like what part of what I want to talk to you about is the Netherlands, this small little country, is really making a name for itself within metabolic psychiatry, and you're certainly part of that. And you're involved in so many interesting trials, and you have such an interesting sort of personal background. So I want to talk about all that. But before we do, please tell us, about you. Give us your background so everybody knows who you are.
Yeah, sure. So I'm a medical doctor in the Netherlands, and I'm currently doing my psychiatry residency, and I'll be due to finish it in about a year and a half. And I'm doing that at Parnassia Group, which is the largest mental health care organization in the Netherlands. And aside from my clinical work, I love to do research. I've loved doing research from the moment I set foot in university, actually. So I started out with a Master of Neuroscience in Erasmus Medical Center in Rotterdam, where I also did my medical degree. Then I got into a little bit of clinical genetics research-wise, and then I moved to pathology, both clinically after I became a medical doctor, and in research. So I did a PhD in neuropathology, where I looked at blood vessel formations in brain tumors. Um, and then I moved to psychiatry, which for me is the best choice that I could have possibly made. It's like the integration of everything that I find interesting and fascinating, both clinically and in terms of research. So my research background has been more on the fundamental side, and it's only recently that I'm starting to move into the field of clinical trials, for instance. So that's kind of new for me.
Yeah, so I mean, really interesting as a medical doctor, but with such an extensive research history. And I love to hear that you found sort of the perfect mix for you in psychiatry, both clinically and research. So what is it about psychiatry that draws you? Why is it such a good fit for you?
Yeah, I think it's a combination of things. So one important factor is that I have a bipolar 2 disorder myself. So I've dealt with mood episodes from my teenage years, and that got me fascinated into like how is it possible that the brain can create such different experiences? Like they are so widely deviating, being depressed, severely depressed, or being hypomanic. It's like living on a different planet, basically. Like how is that possible? And that in itself got me really fascinated into like how does that work? How does the mind do that? Like um and it also yeah made me interested into like okay, these experiences that I have myself, like do other people have them? And eventually of course I found out, yeah. Luckily enough I'm not the only one. Lucky for me, not so lucky for other people, but um and I feel it also helps me like having this experience myself. I feel helps me both in my clinical work, because it's kind of easy for me to put myself in the shoes of a lot of my patients, right? I part of me knows what they're going through, but it also feeds into a fascination, into like how does the brain work? How does it lead to psychiatric diseases? How can you influence it? How can you input? So I can use part of my own experiences of what works and what doesn't work to also feed into research questions. Um, so at this stage in my life, also having come to grips with, having bipolar myself, which took a long time, of course. Having come to grips with it more, I feel that I can finally use it to my benefit. Because obviously, it's like I'm not going to romanticize it in any way. Um, but I feel that it took a lot of like hard work and effort, and also being in an environment that is supportive, because I can't emphasize enough how important that is to have a supportive environment when you're dealing with a condition like this. Having all that right now, I feel I can actually use it to my benefit, to a certain degree. So that's, yeah, I do feel grateful for having reached this point.
Wow. Wow. What a powerful story. I mean, and just it shows your true scientific mind that by having this yourself, you wanted to dig deeper into the science behind it and understand it better, and how that led to your research. And then also just the compassion and the empathy for others going through it to be able to feed sort of the clinical side of things. So I think that's amazing and such a great story. And you're not new to research, and certainly not new, I guess, to metabolic psychiatry. Because I remember reading from you that back in 2005, you had written a protocol to study a ketogenic diet and schizophrenia, which would have been sort of a landmark trial back in 2005, but eventually did not pursue it. So I want to hear about that background in 2005.
Yeah. Okay. Yeah. Yeah. So in 2004, 2005, I was doing my Master of Neuroscience in Erasmus Medical Center. And I was doing it in the field of schizophrenia. So it was a collaboration between neuroscience and psychiatry. So I started reading about schizophrenia, and for some reason I came across that one paper from, I think it was 1969. It was a case report on a woman with schizophrenia who responded well to a ketogenic diet. And then I started reading about the ketogenic diet for epilepsy mostly, and like what it can do and the major impact that it has, that it can have on treatment-resistant epilepsy. Um, and then I thought, well, there's something here. There is something there where theoretically a ketogenic diet could work for schizophrenia as well, if only when you're looking at the glucose metabolism problems that patients with schizophrenia have. If you're only looking at that, ketogenic diet could possibly help for that. And I wrote, because my supervisor at the time, I'm working with him again now. That's kind of a funny coincidence. But he was excited about the idea, so he told me you should try and write a small grant for it. And we applied for a small grant from Nutritia Foundation. We didn't get it, and I was reaching the end of my master's degree, and I was about to go into my clinical rotations for my medical doctor degree, and then we kind of dropped. We dropped the idea, so that's where we left it. And funnily enough, I'm doing my psychiatry residency now, and my supervisor from back then, who was doing his PhD then at the time, is now my supervisor for my psychiatry residency. And he kind of told me yeah, but that was a nice idea. Maybe we should consider doing something with that again, with keto interventions. And at that time, because that was a few years ago, I had read about ketone esters, ketone salts being available, and I thought, well, I think for a lot of the patients that we're dealing with that are struggling with either an acute episode, acute psychotic episode, or they have chronic treatment-resistant schizophrenia. They may be addicted to drugs, which a lot of patients regretfully end up struggling with addiction and with other psychiatric problems. They may be indebted. They may not even have a house. They may not even have a home. For a lot of these patients, starting a ketogenic diet can be super challenging. So we thought a supplement could actually be a way to achieve ketosis that is more achievable for more patients. And that's how we started on actually focusing on ketone esters for the trial that we're currently doing. So yeah, this current trial basically has a 20-year history to it.
Yeah, it's
Funnily enough,
amazing.
yeah.
A 20-year
Yeah.
history run up. But so interesting to transition to the ketone esters and the exogenous ketones for exactly those reasons. Not everybody's going to be able to start a ketogenic diet, but if the ketones help, then use them as sort of like a medication, as a supplement. So yeah, I think that's super interesting to look into, and something that we've been talking about a long time at Metabolic Mind, because we get a lot of these questions. Well, what about exogenous ketones? What about ketone esters or ketone salts? And we just say, well, there's no data on it, but it sort of makes sense that it could help. It just needs to be studied. So that's why I'm so excited that you're doing it. So tell us a little bit about the structure of the trial and how you have it set up.
So for this, it's a pilot study. We managed to obtain funding from Amsterdam Neuroscience, from a proof of concept grant. So it's not a very large grant. So it's sufficient to cover a pilot study. It doesn't cover personnel costs. So basically everyone who is collaborating is doing it because they're motivated to do so. The study is set in Amsterdam University Medical Center in the Department of Early Psychosis, which is headed by Professor Liewe de Haan. And he has a tremendous track record and a lot of experience in doing research into this patient group, early psychosis. Because it's not easy to include this patient group in research studies. So that requires a lot of experience on its own. And that's a logistics that is all set up there. Making this study so far, we're doing well with inclusions, but that's because that framework already exists. And because this is a pilot study, we decided to go for a single injection. So we designed it as a crossover study, randomized controlled. So subjects are randomized to either receiving the ketone ester drink first, then there's a washout period, and then they receive an isocaloric carbohydrate control drink, or the other way around, first the control drink, and then the ketone ester. It's triple blinded, so nobody knows who is getting what drink until after everything is done and analyzed. And because we're focusing on a single injection, we're obviously limited in terms of outcome measures that we can reasonably look at. Like looking at clinical effects, that's highly unlikely that you're going to see something after a single injection. So we decided to focus as a primary outcome measure on event-related potentials. Those are measures that you can measure using an EEG cap or an EMG. And specifically, we look at pre-pulse inhibition of the startle reflex. And the reason we look at that actually because of a paper from Professor Sanjay from this community. He looked in a mouse model of schizophrenia, and he found that pre-pulse inhibition of the startle reflex, which is detected in schizophrenia and disrupted in this mouse model, was restored after a single ingestion of ketone ester. So that's why we thought, okay, if we can repeat that in human subjects with schizophrenia, that would be extremely meaningful. And for the rest, we're looking at a ton of other outcome measures like cognitive functioning we expect can improve after a single ingestion. We're using indirect calorimetry to look at energy substrate utilization, resting energy expenditure. We're asking patients how they feel, of course, like do you notice any effect on your mood or on your ability to focus? And we're looking at a lot of metabolic and immune outcome measures, like we're looking at ketone body levels in blood, obviously. And if we have the funding for it, we would like to look at some inflammatory markers as well, oxidative stress. And one other thing that I'm pretty excited about in this study is we're using a wearable device that is really new. So I'm collaborating with the University of Texas Dallas and License. It's a startup that was also started by the professor in Dallas, and they are specialists in nanotechnology. So they developed a wearable device that can measure biomarkers in passive sweat. So you basically have a device that you stick on your skin. It's the size of a watch. You put it on your skin with a sticker. You wear it for a couple days, and then you need to change the sensor. While the person is wearing it, every 3 minutes, there is a measurement point for biomarkers in passive sweat. And we are looking at cortisol and melatonin, because when you have those two combined, you can actually gain insight into the circadian rhythm of the person who is wearing the device. And we're looking at interleukin 6 and TNF-alpha, two important pro-inflammatory cytokines that are also involved in schizophrenia and bipolar disorders. And these data are going to be completely novel as well, because usually you don't have the dynamic profiles of these biomarkers. You just have like a single time point. So we're also really curious to see, first of all, just the profiles that we're going to find in this patient group, but also if an ingestion of ketone ester influences these biomarkers or not. So yeah, we're doing a lot of data collection in the study. It's a bit top heavy in that regard. Yeah.
Wow. Yeah, that sounds like a lot of data that you are collecting. Really impressive, just the breadth of investigation that you're having. And I can see so many different potential outcomes, but since it's a one-time ingestion, and it's a pilot trial, it's really going to feed future research and future research ideas, which I think is super fascinating. And, hopefully we'll be able to get more funding for longer trials, longer, terms of ingestion. But I'm curious about one thing, one practical question. You said it's blinded. Ketone esters taste awful. So I'd imagine like there's a taste. So what are you doing to try and I shouldn't say they taste awful, but they're not the most pleasant tasting thing most of the time. So how are you masking the taste to try and make it similar to the carbohydrate drink?
Yeah, we're not masking the taste, not in the sense that we're not trying to make it taste the same, because I think that's really difficult. And if you want to do that, you would need to add like a bittering agent or something to the control drink. Not 100% sure. Like the moment you start adding agents to a control drink, yeah, that can have a biological effect as well. What we did do is we used a control drink that is considered really unpalatable as well. The taste is different. I tried both drinks and I find them like almost equally unpalatable. So they definitely taste different, but they're both just pretty foul, to be honest. Um, and the way we further stimulate blinding is like in the subject information we describe that both drinks have an unpalatable flavor and texture, which is true. So they are slightly different, but we don't give away which might be which. Also, the investigator involved in the trial doesn't know. She deliberately didn't try either of the drinks, and we didn't tell her how they tasted or anything. So she doesn't, even if she could maybe gauge a reaction from a subject on how it tastes, but then she wouldn't know how to interpret it. So yeah, that's how we go about blinding in this study. And blinding it's never going to be perfect, but this is the method that we chose for this particular study. Yeah.
Well, now I guess you might not be able to answer this next question until you have your results, but what do you hope or think would be a next step after this to further the research?
Yeah, after this, like it's going to depend on our results, of course, but if they are even remotely positive, or even if they're negative and we can explain why they might be negative, regardless, we obviously want to do a follow-up trial. And obviously that would be with a longer period of supplementation. Um, and we're looking for funding for that. So we applied for 2 grants at this stage to see if we can manage to do a follow-up study with then a 2-week suppletion period, 4 times of ketone ester a day, and a similar design, also crossover, placebo-controlled, blinded. And then we can look much more into the real clinical effects. Like we could look at psychotic symptoms, symptoms that I'm really interested in and that are now treatment resistant, generally are negative symptoms in schizophrenia, which is more the loss of motivation, loss of interest, social withdrawal, just affect flattening, and these symptoms are extremely debilitating for people with schizophrenia, and we don't really have a good answer for them. So I would love to see if ketones can actually improve those symptoms that we don't have an answer for. The same with cognitive problems. That's another area that people with schizophrenia are really limited by. They experience a lot of cognitive deficits, which prevents them from being able to continue their studies or holding a job. So if those could be improved, that would be absolutely amazing. So those would be the areas that I would love to focus on. And also with a longer trial, like one of the grants that we wrote would also include fMRI and MRS to sort of look at the mechanism. Of course, like how do ketones work? How do they affect the brain in these patient groups? So yeah, that's sort of the general direction that we're hoping to be able to go into in the future.
Yeah, it's ambitious, and I love that. I love
Yeah.
ambitious research plans. And so I guess the next question, though, which I sort of hinted at the beginning, is this metabolic psychiatry, ketone psychiatry research community within the Netherlands that seems to be popping up. I've been fortunate enough to have an interview with Dr. Aline de Keister, who's also in the Netherlands, and then of course you. So what is it about the community and the culture, and why do you think the Netherlands, and what has been so hot and popular in that area about ketone research in psychiatry?
I'm not even sure if it's starting to become popular, but I think that's mostly in reaction to the work that is funded by Bezuki Group and the papers that are coming out. Um, yeah, so it's starting to develop into something really serious. And I'm really lucky to have run into Eline de Keister. Like, she reached out to me on LinkedIn actually when I posted about this trial that I just mentioned. And since then we're talking a lot, like we're collaborating already, and we want to extend our collaboration more and more into the future because we just have similar aims and different things to bring into this field as well. So I I honestly do feel that we're starting something very meaningful in the Netherlands. And one advantage of the Netherlands is it's a tiny country. It's also the most densely populated country in all of Europe. So the logistics are kind of easy to manage. Everyone is relatively close by. Like I can go to Elina and be with her in 45 minutes, and she's in a different city. So it's um and that's, I think, an advantage in the Netherlands in general, that the lines are kind of short because we're so many people in such a tiny space. Um, yeah, and I'm just really lucky to have the opportunity to collaborate with Amsterdam University Medical Center, which has a tremendous track record when it comes to research into early psychosis and in bipolar disorders. Um, so finding strong collaborators like that, I mean, that's what makes a project succeed or fail. So I was lucky enough to, um, yeah, to find these collaborations and to be offered these collaborations, and that's what makes the project successful to this date in terms of like including subjects and everything and data acquisition.
Well, I think that's fascinating, and I'm really excited to see the research that's going to come out of your community. Before we continue, I want to take a brief moment to let our practitioners know about a couple of fantastic free CME courses developed in partnership with Bezuki Group by Dr. Georgia Eade and Dr. Chris Palmer. Both of these free CME sessions provide excellent insight on incorporating metabolic therapies for mental illness into your practice. They are approved for AMA Category 1 credits, CNE nursing credit hours, and continuing education credits for psychologists, and they're completely free of charge on mycme.com. There's a link in the description. I highly recommend you check them both out. Now back to the video. But now let's transition to sort of the clinical side, right? You're a psychiatry resident. You also, in addition to doing research, you're taking care of patients. So, the research is emerging, but from what you know at this point, when you're taking care of patients, are you putting people on ketogenic diets? Are you giving them ketone esters or exogenous ketones? Do you think it's at a point now where it can be used in the right setting with the right, monitoring and the right advice and coaching and so forth? Do you think it's at a point where you can, and are you using it clinically?
I'm not using it clinically myself, but that's also because I'm still in my residency. So I do rotations in different areas. I have different supervisors. And the status, like the way it is seen, at least within psychiatry in the Netherlands, the people that I've talked about ketogenic diet, ketogenic interventions with, it is seen as an experimental treatment, which I do understand. Like there is a lot of evidence, but we still don't have kind of the gold standard evidence that we would need to convince, yeah, psychiatry in general to put this as a treatment into their guidelines. So I think it's important that, I mean, those are ongoing, right? Those trials, so we're going to get there. That having said, it's possible to use experimental treatments in patient care. It's possible to do that under the right circumstances, right? You explain to the patient that there's some evidence, but it's not like crystal clear yet. You explain the disadvantages, the possible advantages. You need to know what you're doing as a clinician, so you need to be trained as a clinician. And then you can embark on a journey with a patient to just try something new and see what happens. Like, there's no guideline that tells you that you're not allowed to do that. Obviously, you need to know what you're doing, and you need to do it for the right reasons and with the right arguments. And I think also be humble while you're doing it. Like, say, just basically admit, like, yeah, we're not sure yet. Like, maybe it's worth a try. Maybe we can do this together.
Yeah, and it's so interesting to think about it because it's nutrition. It's a diet, right? Everybody's got to eat. It's not a pill. It's not something that you either take or you don't, right? Like, you either take a pill or you don't take a pill. But for diet, you have to eat. So I find it so interesting. Like, where's the threshold for different people to say, well, you can start eating this way and then, still take your medications and kind of follow you and see what happens. And obviously there are things that can happen with medicine potentiation and, whether it's the keto flu or different changes that happen with ketosis. But like you said, if someone's aware of that, but for an attending, so for you, you're in a really interesting spot being a resident, right? Because you know all about this, but your attendings probably don't. So in that case, you can sort of flip the script a little bit where you're the educator and they're the student. And I'm just curious, like, how would you feel in that type of situation? Because with the power dynamics and the authority and things, like, sometimes, the resident may not want to sort of educate the attending because it can seem, like you said, you have to be humble. Maybe it seems like you're being arrogant or something, even if you're not, right? So I'm just curious, how do you feel about that?
Yeah, it's like, I think in that sense, I'm also lucky. Like, the organization where I work, it's not very hierarchical. So there's a lot of openness. Like, you're allowed as a psychiatry resident to like give your own opinion, right? And state how you see things, and nobody is gonna look badly upon you. On the contrary, actually. So I do find there is interest, but also skepticism when I bring up this subject, which I think is healthy. That I feel that's a healthy response. But also, like, because our trial is going pretty well, and there's like more and more exposure for this subject. I know that there's other groups that are interested in like looking into ketogenic diet and the effects of it in psychiatry. And also, of course, the group that I'm working with in Amsterdam and in Parnassia group. And one thing that I'm really excited about is I'm going to start a policy rotation, is what we call it, kind of like to as a psychiatry resident to look into all the policy that is required for psychiatric care. So I'm going to do a policy rotation at Parnassia Group in a clinic that is basically dedicated to psychiatric care for the chronic treatment-resistant patients out there, like the ones that are not included in trials right now, because they have comorbidities and they are, some of them are addicted and some of them have intellectual impairments and all those millions of exclusion criteria, basically, that usually are in place for clinical trials. So these patients are, in terms of research, kind of the forgotten group. And what we want to do during this policy rotation is actually see if it is at all possible to start a metabolic psychiatry expertise center at Parnassia Group. And that would be combining patient care, with research, like at a high level, through collaborations with academic centers. And nutritional ketosis would be one of the treatment options that we would like to offer in the Metabolic Psychiatry Expertise Center. And for that, like, people will need to be trained, we will need to attract dietitians. So there's a lot of things to figure out, and it can not happen in 1,001 ways. It can go wrong. But I know that Parnassia Group is interested in this idea and in seeing if it's possible to set this up. So I think that's very hopeful and exciting, honestly.
Yeah, that sounds very exciting. And I just hope other, whether it's a medical student or resident, or that they see what you're doing and they sort of learn from your experience and the example you're setting to say, hey, I can do something similar within my institution. Because really, I mean, I think the stereotypically, the younger physicians might be a little more curious or a little more willing to experiment. The older physicians a little more set in their ways. Totally stereotypical, not true for everybody, but maybe, more than 50% of the time it's that way. So to get the earlier career physicians to be a little more curious and try things like that, I think it's a fantastic example. And I really love the work you're doing, and I'm excited for it. So where can people find out more about you? Where can they follow you to learn more about your work?
Mostly on LinkedIn, I would say. That's the place where I post updates on research. So that's the best place actually to see what's going on. Yeah.
Well, great. Well, I, for one, am definitely going to follow you on LinkedIn and keep up with all the work that you're doing. And thank you so much for joining me at Metabolic Mind. I really appreciate you taking the time.
Thank you so much for having me, Brett. It was my pleasure.